Chapter 47, Eye and Ear Disorders. The eyes are controlled by the third, fourth, and sixth cranial nerves, and from there connected to six extraocular muscles. The eye has three layers, beginning with the cornea and sclera, down to the iris and ciliary body, and finally the retina. Disorders of the eye are problems that may occur as a result of things like injuries, infections, or even specific non infectious eye disorders such as glaucoma or macular degeneration. The first infection of the eye we'll discuss is pink eye, and this can occur due to everything from allergies, viruses, or even bacteria. Other ocular conditions caused by pathogens include things like blepharitis, hordeolum, or uveitis. Other issues may relate to age related changes such as macular degeneration or a deterioration of the macula. And there are two different types. There is the wet that progresses rapidly, where growth and leakage of abnormal blood vessels behind the retina begin to shift. The vascular endothelial growth factor inhibitors are injected into the eye. And there may also be dry, which slowly deteriorates vision over years. There's no known treatment, and the progression can be very slow and insidious. Another would be glaucoma. This is increased intraocular pressure or increased pressure within the eyeball. And it comes in two types. There's open angle, where the trabecular meshwork structure is open but becomes clogged, and the intraocular pressure gradually increases, damaging the optic nerve. Then there's also closed angle, in which this case the iris is situated close to the drainage angle and then blocks that trabecular network, causing excess aqueous humor that cannot be drained. Another major factor when dealing with eyes is going to be medications for diagnostic purposes. The first would be topical anesthetics. These are selected aspects for a comprehensive eye exam to limit the patient's discomfort. They also can locally block pain signals at the eye's nerve endings. There's also diagnostic stains. These locate extraocular lesions or foreign objects, also help to evaluate dry eyes or extraocular changes, while allowing a more thorough examination. Anti-infectives. These are medications used to treat specific eye infections. Again, everything from conjunctivitis, blepharitis, hordeolum, or uveitis. Anti-inflammatories. These would include things like cyclosporin, ophthalmic NSAIDs, or corticosteroids. There's also anti-allergy medications such as antihistamines or mast cell stabilizers. Decongestants or ophthalmic decongestants specifically. These stimulate alpha adrenergic receptors in the arterioles of the conjunctiva that results in a narrowing blood vessels and decreasing congestion. Examples would be things like phenylephrine and are contraindicated in angle closed glaucoma. Lubricants, these moisten the eyes to relieve discomfort or burning and irritation. They can also be used to moisten contact lenses or artificial eyes, as well as moisten eyes during anesthesia for central nervous system disorders. Mydriatics and cycloplegics. Mydriatics work to dilate the eyes, while cycloplegics paralyze and keep that pupil open. Are used for diagnostic procedures and would have side effects like dry eyes and mouth, photophobia, which is why you often see patients with those dark lenses as they're leaving the optometrist's office. Glaucoma and ocular hypertension drugs, things like prostaglandin analogs. These work to for open angle glaucoma and ocular hypertension. And they work by improving the trabecular outflow and increasing uveoscleral pathways. Examples would be drugs like bimatoprost. And side effects would include things like iris changes, darkened eyelids, macular edema, blurred vision, and redness of the conjunctiva. Other drugs used in glaucoma and ocular hypertension include cholinergic agents, used for open angle glaucoma, ocular hypertension, and again, working to improve the outflow of the aqueous humor. Examples would be a cholinergic agonist or cholinesterase inhibitors. Side effects would include things like ocular irritation, retinal detachment, and cardiac irregularities. Beta adrenergic blockers, used for things like glaucoma and ocular hypertension. These reduce intraocular pressure by decreasing the production of aqueous humor. A good example of that is going to be a drug called timolol. And side effects include eye discomfort, meiosis, bradycardia because it is a beta blocker, AV heart blocks, and heart failure. Alpha adrenergic blockers. These control or prevent elevations in intraocular pressure. They also decrease production and improve the outflow of aqueous humor. Examples would be things like apriclonidine. The side effects would be things like burning, stinging, blurred vision, headache, corneal erosion, and dysrhythmias. Carbonic anhydrase inhibitors. These are used for open angle glaucoma and acute closed angle glaucoma, working to decrease the production of aqueous humor. Side effects would include things like lethargy, drowsiness, headache, and seizures. When dealing with glaucoma and ocular hypertension, we want to focus on the patient's sensory perception, checking baseline visual acuity as well as intraocular pressure measurement. We should also assess for any contraindications for glaucoma drugs. Monitor for any significant alterations in the patient's status, and monitor the patient's xerostomia, dehydration, fluid overload, electrolyte imbalances, blurred vision, bradycardia, tachycardia, or even hypertension. You should also advise the patient to never stop these medications suddenly, and counsel the patient with glaucoma to avoid any other drugs with the potential to raise the intraocular pressure. Moving on to the ears. The ear is divided into the external, middle, and inner ear. The external ear disorders can be treated with over the counter products, and prescription drugs are usually required to treat the middle and inner ear disorders. Common disorders include things like acute otitis media or acute otitis externa. Anti-infectives for things like acute otitis media and acute otitis externa would be antibiotics like amoxicillin, azithromycin, while otitis externa would be things like neomycin. Side effects would include burning, stinging, superinfection, ototoxicity, and bone marrow suppression. Much like with the eyes, when dealing with the ears, we're going to focus on the patient's sensory perception. We want to record otoscopic exam findings for future comparisons, as well as check the audiometry and perform other testing as indicated. Complete any culture and sensitivity testing before starting the drug therapy, as well as provide relief of any associated pain, and assess the patient for any development of superinfection. You should also instruct the patient to complete the entire course of the medication, and instruct the patient to wear a medical alert bracelet at all times if they're allergic to any medications. Antihistamines and decongestants. These are not effective for middle ear congestion, as well as eustachian tube dysfunction associated with otitis media with effusion. There is also a risk of adverse effects outweighing the benefits, such as with antihistamines and decongestants. Our nursing role is going to be to educate the patient. Ruminolytics, or breaking down the earwax. These are topical otic agents that soften or break up the earwax so that it can be removed. They come in water-based products to provide hydration to the dried earwax, or oil-based products that lubricate while also softening it. For our first practice question, the nurse is teaching a patient with glaucoma. Which herbal product should the nurse include as not recommended for patients with glaucoma? That be A, garlic, B, St. John's wort, C, golden seal, or D, valerian? That answer is going to be C, golden seal. For question two, the nurse is showing the parent of a 2-year-old child how to administer eardrops. Which are the correct statements? Select all that apply. That be A, pull down on the auricle, B, pull up on the auricle, C, position the child's head with the affected ear up, D, position the child's head with the affected ear down, or E, warm the eardrop in the microwave prior to administration. That answer is going to be A, pull down on the auricle, and C, position the child's head with the affected ear up. In very young children, we're going to pull down and back on the ear, whereas for everybody else, we're going to pull up and back to align that ear canal. Question three, pilocarpine has which action on the eye? That be A, meiosis, B, mydriasis, C, ciliary muscle paralysis, or D, pupillary dilation. And that answer is going to be A, meiosis, or a contracting of the pupils. Question four, which is the most common side effect or adverse reaction associated with prostaglandin analogs for the treatment of glaucoma? That be A, hypokalemia, B, renal calculi, C, a change in the color of the iris, or D, postural hypotension. And that answer is going to be C, a change in the color of the iris. And for our final question, a child is treated 4 times during the summer for external ear infections or swimmer's ear. Which of the following does the nurse teach the family to best prevent these infections? That be A, refraining from the submersion in water, B, continuing antibiotic therapy through the summer season, C, taking high doses of vitamin C, or D, using custom fitted earplugs. And that answer is D, using custom fitted earplugs. But anyway, that's all we got for this chapter. I'll see you in the next slides.